As per our Indian tradition, we light the ceremonial lamp with the aim of filling the entire ambience with light and positivity. Thank you all. And thank you, everybody.
So here we have somebody with us, though virtually, he could not attend this summit physically today, but somebody who is in the helm of building the backbone of India's technological digital revolution, from Aadhaar to many other revolution which we saw in the telecom industry, and also now being the CEO of NHA, he is building the digital health backbone of the country. And I'm sure this is something which is going to change the whole face of how we have been accessing health in the past, and going to ensure that each and everyone, nobody is left behind when it is coming to getting the essential supports like healthcare. So Dr. R.S. Sharma, over to you for your kind words today.
Thank you very much, and good morning to all of you friends. First of all, my apologies for not being able to be present physically, though the distance is not much. But unfortunately, I had a back-to-back kind of engagements, and those were fixed from before, so I could not say no to anybody.
Do we have the connectivity? At that side.
In progress.
These are still the gaps in the digital health which need to be filled in. Sir, you are back. Sorry.
Yeah, I'm back, but looks like the internet connection. I mean, I don't have any problem at my side, because just now I addressed another, other gathering. So, but anyway, I hope I'm able to sort of complete this kind of interaction with you. So first of all, thank you very much for inviting me to the second ISW Digital Health Summit and Awards 2022. You know, some decades back, we used to have a lot of conferences on e-governance. And the idea was that, the digital use of digital technologies in governance is going to transform governance. And that was the basic part. Nobody at that time talked of digital health. Obviously, this was before, its time had come in some sense. Now, I want to emphasize this once again, that the digital health, in the word digital health, what is important is health and not digital. Digital is only an enabler. Digital only makes things more affordable, more cost effective, more time saving, more quality, more accessible. So these are some of the attributes of digital, and I suppose all of these things are required in our country in the space of health. And that is why the honorable prime minister had launched about a year back the Ayushman Bharat digital mission. And the overarching objective of this mission is to, ensure that we are able to leverage digital technologies to the fullest extent. COVID has been a disastrous, impact on the entire world, has had a disastrous impact also in our country. But I think one of the positive outcomes of COVID was increased use of digitization in all sectors. We were not able to go out of our homes and we had to consult our doctors, and therefore we were making video calls to the doctors. And of course, the fact that the data is very cheap in our country, we have bundled mobile connections, we have 600 million smartphones, 800 million, more than 800 million internet connections. So all that makes it possible for us to communicate in a very effortless manner with doctors, with laboratories, with hospitals, and other kinds of things. Again, I think this has frozen, so I'm not very sure whether what I'm saying is going over to the audience there or not. Yeah. So, friends, am I audible, visible, or not? Otherwise, probably maybe some other time I can speak.
So they can hear you.
Okay, fine. So now, the one other question. I assume that you are able to hear me, and if not view me, then at least able to hear me. Otherwise, I'll be talking to my computer only. So one is that why India is, you can ask the question that every country has done it in the past. America has done it, Europe has done it. Why? What is so new about this digital mission? Because everybody is digitized. American health system is largely digitized. European health systems are also digitized. What is so different? Actually, I want to propose to you and I want to assert that what we are doing is pretty unique in its, in its approach and its dimensions and its scale. Uh, is it audible? So essentially, why we are able to, in what way is it different, and why we are doing it the way we are doing it? So one is that from a very start, when we started our e-governance journey, we had taken certain policy decisions. One was that what we will build at a national scale will be interoperable, will be frugal, will be scalable, because we are building for a country of 1.3 billion, which happens to be 1/6 of humanity. So I think these are the attributes. Then of course it should be based on standards. It should be open standard based. It should be open, API based. It should be open source also as far as possible. And these are some of the overarching, design considerations which we have made for our, products or frameworks which we are making. Next part we have done is that we will allow all the ecosystem partners to build applications on top of the framework which we create. So we are not building applications, and we are not at least competing in the market. So for example, Honorable Prime Minister in December 2016 launched the Unified Payment Interface UPI, and he also launched BHIM. But the idea was not that the BHIM will be competing with the payment applications. Idea was BHIM was a reference application. So therefore, we are building frameworks. We are also building reference applications and making all those APIs and SDKs public, so that people can easily make applications on top of that. That's the broad, approach which we are taking. We also have certain digital public infrastructures which can be used in these transactions, whatever domain of those transactions might be. Maybe it is health, agriculture, education, or other things. So for example, we have made digital identity, which is Aadhaar. Now, Aadhaar enables you to plug the digital identity into any transaction. And as you will agree with me, any digital transaction, first stage of that transaction is to require the proof that you are who you claim to be. Now, that's a very important consideration that we have. We have a very easy way of payments because of the UPI. Now, I can remotely pay money to anybody using just, without any commission or other kinds of charges. So it's free, it's frugal, it is available on every smartphone in the country. Similarly, we have made products on top of Aadhaar. We have made electronic KYC, we have made consent artifact, we have made digital locker, we have authentication as a service. So I think these are some of the horizontal products or horizontal digital public goods which India has created, which can be leveraged by any application developer who is developing applications. So that is the broad concept. In fact, Aadhaar also was developed as a digital public infrastructure, and people made applications on top of it. Telecom companies made applications to provide SIMs to the customers to do their electronic KYC. Banks made an application to basically do the KYC and open accounts sitting at your home. And we had JAM Trinity, Janadan Aadhaar and Mobile, which actually ensured accelerated, financial inclusion of the people of our country. So I think that part is already, that story is done, and it is actually flourishing. It's a very vibrant ecosystem which we have created of these horizontal public goods. Now what we are building is specifically in the health sector is essentially the same framework. Now what is that framework? The framework is UHI, Unified Health Interface, which is actually similar to UPI in a way that it is interoperable. And interoperability in true sense means that if I have a teleconsultation application A and my doctor has teleconsultation application B, then I should be able to talk to the doctor without the fact that I have to be on the same application. So this is the true meaning of interoperability, and this opens up market. So we are also doing that function of market making by providing a framework which is universal and also interoperable. And I will give you an example of COVID. Now, COVID is a platform, but COVID is now connected to 150, user 50 applications. Why? Because we have provided open APIs, and now today Paytm is connected to it, Make My Trip is connected to it, health applications are connected to it. Similarly, UHI will actually provide a plug-in infrastructure where all kinds of applications can plug in. Health management information systems can plug in. The personal health applications can plug in. The devices can plug in. The Fitbits of the world, they can actually transmit data to the applications at the edge of this UHI framework. So this is the way we are now creating. Of course, we have also created certain reference, public goods. So for example, we have created the PHR application. We have created the other applications. Next, we have created health registries. Registries are very, very important because that is the only trusted source of data which says that this hospital is a legitimate hospital, a hospital which is recognized by the government, hospital which is proved to be providing services. Similarly, this is a doctor or who has qualified doctor, and therefore health professional registry, health facility registry, drug registry. All these registries will also provide a very good service to all the application developers. So essential idea, friends, of the ABDM is that we have created a framework. Then we have created certain digital artifacts, which are essentially PHR application we have created, which are essentially reference applications. And we expose this entire infrastructure as a digital public goods to the people of our country, the developers of our nation. And that will provide a beautifully connected, interoperable, frugal, scalable framework which will serve 1.3 billion people of our country. And I can assure you that if we can make it happen, because ultimately ideas are there, but these ideas have got to be implemented. And the ideas are worthless if you can't implement them. And therefore, what is required is the collaboration and cooperation of all the stakeholders. Because believe me, this is going to be a platform which is going to benefit everybody. This is not going to be a platform which is benefiting one section and not benefiting another. And ultimately, people are at the center of this platform. So basically, we are creating a framework where a person will be able to see all his medical records, longitudinal medical history he can build on the basis of the records. And these records are not being accumulated at one place. They will be federated architecture, which means they will be there in the hospitals in which they are created. So this is the broad, philosophy and architecture. And I can tell you that this is a robust architecture which has been proven in a number of digital public goods which our country has created. And I'm sure this will also, transform the delivery of health services in our country. But, and this is a big but, that if we are able to make it happen, if everybody is able to come on the same page, it is not that, for example, hospital A can say, oh, I will create digital records, but I will not share the digital records. But look, this is not your records. These are records of patient. And patient is the master of these records. And therefore, you have an obligation to share these records with the patient. And it is the patient who will decide with whom he wants to share, who he or she wants to share. Therefore, for creating this digital infrastructure, we will need the support of everybody. And I'm sure all the participants who are there in this conference, which is basically Digital Health Summit, and it is going to recognize the people, the persons and innovators in this space who have created wonderful applications. Now, this recognition will actually give a further fillip to the to this journey of digital health, and I want to compliment IHW for basically making it happen. Thank you once again, friends, and have a very good conference ahead of you. Thank you.
Thank you so much, Dr. Sharma, for first of all sparing time from your busy schedule today and sharing your thoughts, and also the grand glimpse of the wonderful work which is being done under the Ayushman Bharat Digital Mission. This is something which is, I think the whole industry, all of us are enthusiastic about, because this is what is going to be most critical in ensuring that the delivery of health reaches to the last mile, to the last person at the row. So thank you so much, and thanks to all the the people in the government of India, and also the Prime Minister for his visionary leadership for ushering in the era of digital India and digital health. Thank you so much, sir. So, let's begin our discussion for this, and I think Dr. Sharma has set the tone for the discussion. What he has also tried to kind of convey that, and which I also feel that we have to kind of demystify, dejargon the word digital health. When we talk about digital health, many times or sometimes we forget, we think about those gadgets, those technologies, those interfaces, and we forget that this is about delivering the care to the people, the ultimate care, saving lives, ensuring that people who are in pain, we are able to kind of bring relief to them. So let me just begin with a small imagery, and this is related to a 2009 movie, Three Idiot. I think all of you would have watched that movie. And if you remember a scene in that, and which was quite an emotionally charged scene in the movie, when Rancho or Amir Khan is kind of assisting Mona Singh in a relatively complex delivery, while getting guidance from Kareena Kapoor, apparently a doctor from a remote, kind of hospital, remote within the city. And you can understand that when it comes to delivering care, sometime, it doesn't matter which part of the country you are, even being in the middle of city may not make you access the health care when it is needed. A city like Delhi, Mumbai, if you get some real, kind of emergency, and you may not even to be able to navigate a city road on time. So what I see, almost 12 years back, much before what we saw, in COVID and, all that digital revolution which happened, we started consulting doctors online, we started consulting doctors on phone, we started getting so many health, kind of support digitally. 12 years back when we saw that scene, I think many of us would not have, it might have been, something distant. Now, fast forward to 2022, I think what we need to achieve is the same kind of scene. Only change has to happen, that instead of a normal guy, rancho, a technician, a healthcare worker, a trained healthcare worker is helping performing any kind of treatment, including maybe the what which was portrayed in that. And also on the other side, the doctor may not be in the same city. The doctor may be sitting maybe 500 kilometers away in a multi-specialty hospital, and guiding that treatment at a remote place. That is what I think we need to achieve when it comes to digital healthcare. That's the way I look at it from a very layman point of view. So let me begin with the the lady in the panel. So Swati ji, I was seeing the wonderful AV of your Optum, which is your, United Health Group company. And it's the message is that we need to, kind of understand, sensitize with each and everyone and try to, kind of bring care, relief, and support to everyone. Health is very human, and digital and technology is like very sci-fi thing. How do you see that, both of them amalgamating in India and trying to achieve what we are trying to achieve is to deliver the care to everyone, everywhere, and anytime it is needed?
Yeah, thank you. Thank you, Kamalji. And, thank you, IHW, for actually giving me the opportunity to share my views and Optum's views. And of course, I'm here to learn from the panel and from the audience. This is a very pertinent subject. And this is a subject that touches everyone individually across industry, whether they are in business, not yet working, or anything. So, this couldn't have come in a more opportune time. But coming to your question, right? So healthcare, you're right, is very humane. It is about the experience that a patient goes through. It's the experience that the clinician has so that he or she can actually give better value to the patient. So the entire healthcare ecosystem is something that needs to be very resilient, interoperable. That means access to all, in addition to, of course, being interoperable and bringing in that agility and scalability. When you're sick, you don't have time, right? And the entire system should be able to build that trust and that value within the patient. And if you saw the Optum, video, one thing that stands out is that every patient should feel very happy about, hey, I know more about myself today and my health, and I really value health. And the entire ecosystem works towards that. COVID stressed healthcare infrastructures across the world, and definitely in India. We fought strong and hard, and we recognize that there are gaps in the current healthcare infrastructure, and we need an ecosystem that is not only agile and scalable, like Dr. R.S. Sharma spoke about. It delivers high quality healthcare, delivers trust, right? And also is very affordable. Medical inflation in India jumped at its highest in 2021, and it's so easy for healthcare costs to just skyrocket. Many people did not fall sick because of just the sickness. It was the sheer shock of their, lifetime finances going down the drain. So we need a system that is almost like a living, breathing ecosystem that brings all aspects of healthcare together. So it's not only the medical community or the providers, it is the insurers, it is the seamless payment systems, it is all those smart tech professionals who will bring in tech innovation in this digital decade. We recognize that the today's healthcare system and future healthcare system is anchored on digitization because of the advantages of access, quality, and affordability. So my view is this, right? So when we look at India, we went through stress. We actually stood up to the challenge. But we need something that very easily and seamlessly manages many more pandemics, manages individual whole person healthcare, right? And also ensures prevention of health issues in the future. So it's all about empowerment. And here I would say that we are a country with a very smart startup ecosystem. And this decade should be the decade of digital health innovation. The second thing, if I may just add, is that we are also a hub center for healthcare, health data services to the world. Our IT services industry is very vibrant. And here I would like to caution policymakers that when it comes to healthcare data, which is going to sit central to this whole revolution or a transformation that's going to take place. It's very important that policies are sensitively made to ensure easy access yet deep security, ensure convenience and cross-border movement because medical and healthcare is universal, but at the same time ensure that citizen trust is not broken. And in the same vein, we have an opportunity of becoming the world's biggest hub center for healthcare data processing. And here, when it comes to healthcare data and the trust that other citizens and countries are putting on India, it's important that our policies ensure that their laws and their policies of different countries is anchored on their citizens, and we should not impose anything additionally. So in summarization, this is the digital decade for healthcare. Healthcare innovation is most critical. Our everyday, we are a country of scale and depth and intensity. And the ABDM objectives, which by the way, I'm a big, big fan of, right? So if ABDM is deeply successful, India becomes a case study to the world and to all those developed countries that can actually learn from us. So letting breathe the
Absolutely.
ecosystem.
Thank you so much, Swati ji. We need a system which is enabling, but at the same time is able to deliver empathic, care to the people because, and without breaking the trust, in the long run. Sunil ji, your, NICSI, some of the wonderful products or applications have been delivered by NIC, whether it is, Arogya Setu, whether it is many other, applications. The recent one is the e-hospitals, which is, I think, one of the very important component for ABDM as well. How do you see that, what Swati ji is saying, that the care is something very human. Technology can facilitate it to reach to more people, to reach to them faster, to reach to them maybe even much more affordably. But the care remains, of the same quality. So apart from what you are building as a infrastructure, as a technical backbone, as a base for it, how do we also, ensure that the quality, the care, all these things are also retained and continue to reach to the people?
Thank you very much. Am I audible? Okay. So we are working on two simple points as far as health is concerned. One is to create the electronic health record of every citizen of this country. So that is the objective, and in order to achieve this objective, we are developing a lot of applications. That is objective number one. And second is, we are not developing only applications, we are converting our applications into service. So that I think if patients are not benefited by the applications, so application within the government has got no meaning until unless it is utilized by the patients, by the normal citizens. So service on one hand and electronic health record on the other hand. And electronic health record not for one or a few patients, it is for all citizens of this country. So to achieve this objective, we have two kinds of products and applications available in NIC. So first is basically we develop products. So we have a e-hospital suite. And the second product is Arogya Setu, I think. And e-hospital suite is basically, it's a product which has 5 applications. One is e-hospital HMIS. Second is ORS, online registration system. So it is for the patient. It's a patient portal. It facilitates about taking the appointment from the government hospital, like AIMS and NIMANS, RML. You can take appointment using ors.gov.in. And third application in this is e-blood bank. It's an internal functioning of take care of internal functioning of the blood banks. And the fourth one is e-collab DDS. It's a remote. It's a remote say radiology, teleradiology we used to call it, e-collab DDS. And the fifth one is telemedicine. So these 5 applications, they have been clubbed together to make e-hospital suite. And we have implemented these applications from PSC, CSC to medical colleges. So it takes care of all kinds of hospitals. And about more than 700 hospitals are already using these products. So my experience with this is, now let me come to the policy part of it. See, Government of India came up with one electronic health record standard, EHS standard, in 2016. And in 2017, there was metadata and data standards for health sector. 2018, there was National Digital Health Blueprint. Out of that, 2019, National Digital Health Mission. Then in 20, ABDM, Ayushman Bharat Digital Health Mission. Now we have a set of APIs which are in the form of ABDM building blocks. So I was part, I am happy, I was part of this National Digital Health Blueprint say activity. This report was prepared, I was party to it. And I think 5 blocks which Dr. Sharma has mentioned, and they have been put on ground. Now, how this has helped? These are set of APIs. It is nothing. There is no. There are reference applications or set of APIs. Now, these APIs cannot be utilized. We cannot have integrated electronic health record of every citizen of this country until unless we integrate all of our health application with these 5 building blocks. So we have every application which is being developed by NICSI, including e-hospital, CGHS, reproductive and child health, and other applications. They have been integrated with ABDM building blocks, meaning thereby every application facilitate creation of ABHA, Ayushman Bharat Health Account. So each individual, whether it is rich or poor, if they approach government for interaction with these applications, if you go to say ORS portal, so you can create your ABHA ID from there also. So it means the creation of ABHA ID has been facilitated by all the health application developed by NICSI. Once this ABHA ID is created, if it is available, then it has to be linked with the health record. So our software, all our software, they facilitate, they have been integrated with ABHA, and ABHA is being integrated with health record. That is the second stage. So milestone 1 is creation, second is integration of the ABHA with the health record, and the third one is very important, which is the ultimate objective of this ABHA building block, and that is sharing of health record. So suppose I have a record in AIMS, then I go to RML, then I go to NIMANS Bangalore sometime, suppose, I am able to see my health record in electronic form in any of the ABHA app which is being developed by private sector as well as by the government sector. Now, Ayushman, Arogya Setu is not a tracing app. It has been withdrawn because there is no COVID. So there is no tracing. So if it is not tracing, so we have converted this Arogya Setu app into health app. It means you will be able to see your electronic health record on Arogya Setu. So you can create ABHA ID, you can link your ABHA ID, and you can share your health record or see your health record across multiple hospitals. That is most important. Until unless you have that, and ABHA facilitate that. And it is because of the Ayushman Bharat Digital Health Mission building blocks, 5 building blocks, which Dr. Sharma has mentioned very clearly. And we are working on UHI, Universal Health Interface. And I think that will change the service part of healthcare. So there are so many things. So let me ask. There may be some question from the participants. So let me take rest and
Sure.
go to Anurag.
Thank you so much, Sunil ji. Yeah, important. These building blocks are important to deliver what need to be delivered. Anurag ji, Swati ji also talked about that the system which we are building has to be resilient enough to kind of make us sail through many more pandemics. Actually, the country of our size and our stature or status or where we are as of now, if we see these pandemics going on simultaneously always. So we see, if we pick up any of the disease area, maybe cancer, it's a pandemic in itself. More than 8 lakh people die in our country every year. Most of them because it is diagnosed very late, or if they are diagnosed, they don't get the treatment, on time, or they are not able to afford it. Now, to make that change, we need the policies which can, kind of create it in a manner to address all these major pandemics which are going simultaneously in our country. And to make the policy, we need data, we need evidences. We lack in data. How do you see this entire digital revolution which Sunil ji is, kind of building bit by bit? Dr. Sharma talked about those 5 major blocks. All of, I think the entire sector is contributing to it with this being a, kind of an open platform. This is going to be a revolution for data as well. We are going to have a lot of data to actually understand where we need to kind of bring that intervention. How do you see that changing or shaping the health policies going forward?
Thank you. I think, let me go back to your story, right? So you mentioned the 3 idiots story, right? So if we have to solve that problem and we need to also generate data in the process, right? There are some fundamental requirements. So if you look at where we are today, government has created wonderful highways for digital health ecosystem to be enabled, right? So we have the Ayushman Bharat health accounts. We have close to 23 crore health accounts which have been opened till date, right? So that is an enabling block. The health facility registry, the health professionals registry, which is providing credible sources of information on facilities and doctors, that is also there. But if you look at, the highway is there, but the roads are missing right now, right? So if you look at the construct of Indian healthcare market, and you look at the number of healthcare facilities in the country, there are only a handful of large corporate hospital chains and private sector hospitals which are on to the journey, right? And Sunil ji mentioned about 700 private public sector hospitals are using technology today. But if you look at the overall universe of the problem that we are trying to solve, there are thousands of PHCs, CHCs, the small single doctor clinics that are yet to embark on the digitization journey, right? If you look at what we need to do, we need to make sure that these people are also able to come on board. Now, this requires a bit of policy change, additional funding, as well as innovation from startups and technology players. So I would like to maybe look at 2 separate problems that we are trying to solve, right? If you look at any small setup, any small hospital or a clinic, they don't have the wherewithal to procure technology, right? It requires huge capex investments. They would need to buy a server, maybe set up a server room, etc. They'll need to buy a software, and they'll need trained manpower. Now today, if you look at the solutions available in the market, these are very expensive solutions, requires a lot of capex investments, and I don't think any small clinic can afford to deploy these kind of solutions today. So to solve that, what we need is a SaaS-based offering, which is as simple as buying a Netflix plan, right? If my nearby clinic can buy a subscription and get onto the digitization journey, start getting referral business, right? Ultimately, what they bother about is how this technology is actually impacting their business. So if they, let's say, get this subscription and they get more business coming in from the market, any clinic or any PHC or any small facility would be very willing to invest into technology. The second problem which I generally see is there is a lot of resistance from the doctors also when it comes to technology, right? They are not very willing to generate EHR, EMR when it comes to any large hospital. So we have to simplify technology, right? I think one of the challenges that we have seen is most of the solutions today, they are not mobile friendly, right? But if you look at the mobile penetration in the country, it is far more than the internet penetration. So if we can enable solutions and make them mobile friendly, make it simple for the doctors to at least quickly do an entry, right? Because they are treating hundreds of patients today. So for generating that data, if you don't enable mobility, I think we'll not get there, right? And I have seen a lot of interesting solutions in the market, which have been deployed at least in good reputed private sector hospitals. So the same story has to be replicated for public sector hospitals also, right? So Sunilji is making so many efforts to make sure that hospitals come onto this journey. But I think if we have to make it affordable, accessible, and also make it simple for the doctors and users to come onto this journey. And the policy environment has to be supportive, right? So NHA had published the health data management policy, but it pointed to the PDP bill, right? And PDP bill is taking some time, right? We'll have a new shape and form for the PDP bill. So we need a regulatory environment also to make sure that data is handled in the right way. And we follow laws of the land and make sure that data is not misused when it gets generated. Thank you.
Thank you so much. So you mentioned about, again, the interesting imagery here is parallel. The highways are there, the roads or maybe lanes or maybe, the small connecting streets are missing or need to be built further. But we saw a very interesting, kind of experience, and especially when it comes to COVID vaccinations. We had a highway, which is, let's say, your COVID app. We had a very strong and very, I think, robust public-private partnership when it comes to, kind of delivering the vaccine to the people. And we also saw a wonderful, mechanism of health records keeping, so accessible certification at every, all the time. You can easily kind of get it in your DigiLocker, from Cobain and all that. Seeing that as a very, kind of effective, experience and the kind of activity which actually took place. Swati, how do you see that, this entire technology piece, public-private partnership, and also, kind of the right policy push to kind of achieve it, because when it comes to delivering the care apart from technology, I think like the same we saw in the space of vaccination also, a lot of skilling is also important. One of the kind of roadblock or a hurdle Anurag ji mentioned about that, even many times you don't find the healthcare providers being very enthusiastic about adapting to that new technology. So how you make them the the entire ecosystem get into this kind of technology highway with the right kind of movement and with the right and mile connectivity, and are able to deliver the care as well.
Yeah, and a very, very important question. So during COVID, our country went into mission mode, right? Everyone came together, the government, the private sector, in fact, the citizens too. And all this brilliant stuff got created. But the fact remains is that we did it during crisis. So now, with what Dr. R.S. Sharma is saying, what Sunilji mentioned, right? Now we have to concentrate on the fundamentals and go really deep and wide on that, which means that we've got to get our country into 100% health ID environment. And whatever it takes, which means a little bit of a carrot and stick, but get everyone onto the Aadhaar ID, get everyone to invest in ensuring that data depth exists, right, in our system. Because if we don't have the detail of the data, then all that we are doing in terms of digital enablement would actually go for a toss. It will just remain as a superficial convenience. So we've got to concentrate on ensuring the way we collect, store, manage, and analyze data, and of course give access to data, is where it needs to be anchored there. Convenience and security both together. So 100% health IDs of our citizens. Every day they are born, I think they should start with their health ID. You know what I mean? So that's one. The second thing is keeping health ID very, the EID, if one would call it, to be very easy and convenient. And I think ABDM is already on the right track to ensure that the simplicity in the citizen utilizing and owning that, the access is something that's very critical, and of course more awareness is required there. But the reason is that with healthcare being universal, a doctor in this hospital would want to, let's say, reach out to someone in Denmark or Germany or some other part of the world and say, hey, I'm just sending across the diagnostics, please take a look at, whatever, there's a rare disease that is coming up. So the agility of the data, the convenience of the data is very important. Finally, of course, as a part of the building blocks, the National Health Authority playing a very critical role in building the trust with the security required. And that's where policies and all that come into play. Not only the NHA, but the way data is secured and sensitively handled in the country. And I'm emphasizing on this again because it's not only about our 1.4 billion people and growing, it's also about India becoming a trusted partner to the world of healthcare data. And our policy has to, follow or rather partner with global standards of like a HIPAA, the HIPAA standards, or for that matter, security standards, where there is, easy movement of data. And I think all countries need to come together and sign on something to say, hey, healthcare is universal, human beings are going through, all kinds of issues, and let's try to understand how to solve for it. That's one. The other thing is, going back to healthcare innovation, artificial intelligence, so many other, digital technologies, where we need to not only concentrate on let's come up with the technology of AI, but really involve the clinician with the technologist. They really need to be tied to the hip here. And that's where there needs to be almost platforms that make them partner very, very comfortably. The government can play a big role there actually in bringing this cross-industry kind of, skilling. So with AI, it's not only about technology, it is about the clinician playing a big role in ensuring this is how the data needs to be captured, this is how we would want to see how we can diagnose it, so that AI, when it brings in the concept of scale and therefore decisions around it, it's actually thinking like a doctor and not thinking like just a technologist. Technology is just an enabler. These are just words of caution.
Thank you so much. Very important point you kind of mentioned in that, and I just want to do a quick dipstick here, if all of us, kind of allow me. I think all the people at the audience, everyone has their Aadhaar card, Aadhaar IDs. Everyone, I think, yeah. And most of you are using UPIs. All of you must be using. How many of you have Abha ID? 2, 3, 4, 5, 6, 7, 8, 9, 10. There can be some camouflage also. So, apparently, I think it's still as a people. But yes, thank you so much, all of you, those who have created their Abha ID. To be very frank, I haven't created yet. So I need to do it today, maybe. Yes, so I think there is a lot of gap in terms of awareness. So we are talking about the digital health, revolution, everything is getting digital. We are consuming digital also a lot. But at the same time, when the government is coming up with something like this, which is going to be so critical in kind of, so we never realized when Aadhaar was introduced that it is going to become the, the kind of the most critical thing for doing everything in your life in future, maybe, from bank transaction to getting a driving license to even getting a admission in a hospital, anything and everything is now being done. Or maybe tomorrow even a movie ticket will come on your Aadhaar ID. So, but the same has to be, kind of started to be understood about ABHA, because that is where your, the health care which you expect, which you, require, and which you want that support around you, and you want the easy access to that is going to be coming through that. So that's one thing, and it's a very good suggestion, Swatiji, about that. Why not create a, ABHA ID or health ID at the very, time of the birth certificate when being issued, or maybe your birth certificate itself become your, health ID. Sunil ji, keeping in that mind, you are building wonderful things, and you are facilitating that everyone should get a easy, kind of inroad to get Aadhaar, kind of health ID, is able to store their documents, kind of in electronic health records, and are also able to, kind of access care through e-hospitals and all that. Just seeing this small dipstick which I, did here, how do you see the participation of the people now? And especially, and so when I asked about Aadhaar and UPI transaction, COVID has a lot to do in that, especially in the UPI. Now UPI has become a global phenomenon. I mean, we have something which is the United States asked, their government that do something. Google wrote to US government to, do something on the line of UPI. So that is something which, we are really generating something global, and I'm sure we are going to generate something really global in the digital health space also. How do you see this, kind of adoption of the technology?
I think very important question is, why do we create ABHA ID? We are not creating it because we are not getting any service out of it. Let me be very blunt on this. So we have introduced, with the help of NHA, with the help of ABDM, we have introduced one of the very simple service out of ABHA ID. So again, UPI, it is, you go to Lady Harding Hospital in Delhi, there are standees, there are QR codes displayed at many places. Create ABHA ID, download any ABHA app, PHR app, personal health record app. There are many from private sector as well as from ABDM. And scan that QR code in that hospital. If you happen to go to any of the hospital, just scan that QR code, and within few seconds you will get the queue number for registration, and you sit down. Need not to worry. There is a TV display, and your counter number and queue number, it is displayed on the TV. Just go to counter, tell the department in which you want to go. You need not to tell your name, age, date of birth, address, anything you need not to tell, because already has been captured through PHR app. You have to tell, I want to visit I department. That's all. You have to simply say I. Then OPD slip is in front of you. So this kind of service has been, since our 700 hospitals who are using e-hospital product, we have enabled our software. We are replicating this service of LHMC in other hospitals also. So that is number one. So that is the reason you have to create your ABHA ID, so that in future if you go to any of the hospital in Delhi or outside, you will be able to avail the flawless service, at least OPD registration. Similarly, you can create ABBA ID on ors.gov.in, create your ABBA, you need not to enter time and again. You can create your ABBA ID for all the family members also. You can book the appointment for your family members also. So family record will keep on, say, creating at one place. So this way, this ABBA will definitely
Thank you so much, sir.
help you.
We are a little running out of time. Okay.
No, just a minute.
Okay.
I would like to give the answer to Anuragji's query also.
Okay.
This is,
Quick
see,
one, sir.
see, until unless you understand, you have ABBA ID, you cannot understand what we are talking about. That is why I am
Yeah,
saying.
yeah,
So
important.
Anuragji is, taking Anuragji's question forward, the important is, we have come up with next gen e-hospital. So all the PSCs, CSCs and small hospitals, what they will be onboarding onto next gen e-hospital like creating the Gmail account. So we are simplifying the procedure. And then next thing is, we are using AI also. We have done a small experiment. Let me explain. See, we have trained the AI model with 30,000 chest X-rays of TB patient. And now, if small digital X-ray is basically uploaded using AI model, it will tell you whether you have TB or you don't have TB. And similarly, we have trained the model with 50,000 cough sound, and we have come up with one API which has been integrated with the Ecolab DDS. You upload, there is a small app coming up with the mobile app. You put your sound into it, cough into it, and you will get the idea whether you have TB or not. So madam was talking about AI. So we are in the process of creating small application where the blockchain, AI, and blockchain, I think it will come very soon, because we have to have a trust onto the health record which we are storing in the e-hospital.
Certainly. Thank you so much, sir. He is already on the podium and kind of nudging me out of the stage. So let me quickly, Anuragji, closing remark from you. The last point which Sunilji said is about building the trust on the health record which we are going to keep, and all that data which is being generated. A quick one: where is this distrust you see, and is that the reluctance? There is any kind of possibility of this data breach which is keeping people out of this ecosystem as of now, or this is more of a kind of a policy thought process? It doesn't matter to the people, they will be equally kind of be open to be part of this whole system?
Yeah, I think there are two ways to look at it, right? Why are people not generating health records, or why are health records not getting generated in general, right? So while large hospitals like Apollo, Medanta, everybody has technology, right? But still they are yet to contribute or start contributing to the health record journey. So I think there are two ways to look at solving this problem. There could be a carrot approach or a stick approach, right? In terms of stick, maybe the government could mandate that you have to use a compatible solution which integrates with the ABDM ecosystem, right? That could be a stick that can come from the government. The other approach, which is much more convenient and which will have a better impact, is the carrot approach, where we start providing incentives to the participants, right? So if you look at the US model, there was financial incentives which are provided for generating electronic health records. Maybe the government can look at that, and we have done that successfully in payments, right? So at least for a small duration, if government could also look at providing some incentives for creating electronic medical records, that could be one way. Secondly, what we can also look at is expand the definition, right? We are currently looking at only treatment, etc. Can we make it a wellness-oriented program? can we gamify, some of these initiatives? So we have seen a lot of corporate programs where people have, step challenges, etc. So if we can gamify it, make it much more cooler for the young generation also to participate, and we'll have far more startups coming up and creating compatible applications, right? So that is my two cents on it.
Thank you so much. So thank you all the panelists. I'm not going to take much time in summing it up. I think all of you spoke very much in self-explanatory manner, and this is something which is digital health is the digital is the medium, as Dr. Sharma also said. This is what the health is something which we all need to work for, which is the health services are something which is critical and should be accessible, available, affordable to everyone, and that's what this entire, I think, Mahayagya of digital health, which the country is kind of undertaking, is meant at, is targeted at, and we at ISW Council definitely try to kind of support and assist, like all of you in the industry and the ecosystem, supporting this a great initiative which is going to change the future of the healthcare in our country. Thank you so much. Over to you.
Thank you so much, Mr. Narayan, for understanding the hint also. And thank you all our esteemed speakers for sharing such wonderful, valuable insights on the digital health footprint of India and our national mission. We would like to commemorate this occasion, and may I request our moderator of this session, Mr. Kamal Narayan, to kindly present a small token of appreciation to esteemed speakers. We would like to present a small token of appreciation, starting with Ms. Swati Rangachari. Mr. Sunil Kumar. Can we have the lights on, please? And Mr. Anurag Saxena.